A child who has sickle cell disease should be under a healthcare provider's care, but parents can do many things at home to reduce symptoms and maintain the child's health. All right, guys. Take steps to prevent infections. Infections like the flu can be dangerous for children with sickle cell disease. Children and their caregivers and family members should wash their hands several times a day with soap and water. This is to reduce the spread of the flu virus and other germs. Children with sickle cell disease are more at risk of illness from salmonella. Salmonella is a type of bacterium. To prevent salmonella infection, your child should not eat raw or undercooked meats or eggs. You guys, this is a big one. Always, always, always take a fever seriously, okay? And I say big because kids catch fevers, and a lot of times you want to just give them medication to make it go away. But you absolutely cannot do that for your child or any child that has sickle cell disease. Here are some important points to remember that could save your child's life. Keep a working thermometer in the home at all times. Do not mask a low-grade fever by giving your child medications such as Tylenol or Motrin. It might treat the fever, but it will not treat the cause of the fever. If your child has a low-grade lingering fever, I would suggest you call your child's hematologist to see what they wanted you to do. They may have you come in. In any case, a fever means that there is some type of infection, so you need to get your child to the hospital right away. Any type of fever, low or high, is indication of an infection. You need to get your child who has sickle cell disease to the hospital right away. If you have a child with sickle cell disease, you should have been provided with one of these cards. These cards get you right past the line if you need to take your child to the emergency room. Always be aware of your child's surroundings. Extremely hot or cold temperatures may trigger a sickle cell crisis. Sickle cell pain crisis is a sudden episode of pain throughout the body. To keep your child's body temperature at the best level, always make sure he or she wears a coat during cold weather and spends as much time as possible in air-conditioned areas on very hot days. Staying well hydrated in hot weather may reduce the risk of a sickle cell crisis. Maintain healthy habits. Make sure to introduce healthy practices into your child's daily life. Drinking plenty of fluids to help prevent dehydration and eating a balanced diet are important. Children with sickle cell disease should also participate in physical activity and stay active. Rest breaks are advised. This is so your child doesn't work too hard or get overly tired or dehydrated. Make sure your child's vaccines are up to date. Make sure your healthcare provider is aware your child has sickle cell disease, as the vaccines given may be slightly different for children with sickle cell disease. Learn how to manage pain. Children with sickle cell disease will sometimes have pain episodes. Talk with your child's healthcare provider about the best ways to handle these episodes at home. It may be appropriate to give your child pain-relieving medicines like ibuprofen for mild episodes, or stronger pain relievers for more severe flare-ups. Heating pads, warm baths, and a massage may also be soothing. Reach out to support groups. Children with sickle cell disease, especially teens, may have a hard time coping with their condition because it can cause delayed puberty. They may also feel anxious about having sudden pain episodes. Support groups for children with sickle cell disease can be helpful in learning ways to cope with these situations. Also, these support groups can be helpful for simply sharing their worries with peers who have similar concerns and feelings. Ask your child's healthcare provider or your local hospital for advice on finding a group in your area. Also, you guys, for parents, I do have a couple sickle cell disease groups that I follow on Facebook. I haven't needed to reach out and speak to anyone as of yet, but they are there if I need them. So you can do that for parents as well. And here's who I'm doing it for. You guys, I'm still learning. My baby girl is only 6, but I've been learning since I've had her, since I gave birth to her. And I want to share what I know. And I'll be continuing to share what I know because we have so far to go. Thanks for watching, guys.